With me is Dr. Maria Rivera from Harris County, Dr. David Persse, representing the city of Houston. I want to thank Kathy Fenninger, the past president of Rotary Club of Houston, for providing us with these questions. I also want to beg her indulgence on our trying to get this right, and hopefully the broadcast will go out uninterrupted this time. Let's start off with the questions, and we don't have commercial breaks now, so maybe we can get to all of them, and I guess we can go as long as we want. The first one's on transmission. I tried to turn on exposure notification on my phone and got an alert that had been turned on for your region by our local health authority. What regions are we in and why not? And excuse me, has not been turned on for your region. I'm thinking that they're talking about the state locator for vaccines. I'm not that sure about it. Do y'all have any more insight into that question?
It's available nationally, but in Texas, the governor has decided that we weren't going to do that, and so it's not available in Texas. That's my understanding.
Okay. So it's a national issue that we don't want, right? Europe and
the governor
Brazil,
doesn't want.
Okay. I'm saying we as a state. Europe and Brazil are experiencing an increase in cases. Locally, our numbers appear to be starting a bit of an uptick. Can you share current data?
So as of now, we're still seeing a little bit of a downward trend actually in Harris County. At times it seems like you can see a little bit of a blip if you just look at on the day-to-day, but what we really look at is the 14-day average, because just of how tests come in, et cetera. And so at least for the 14-day average, we're still seeing a little bit of a downward trend, but it's definitely something that we're cautious about, because as the person that's asking the question mentioned, we're seeing a lot of increases across the country and across the world.
So although we're looking okay, it is still concerning that we're seeing something else. Big announcements proclaim that April 19th, 90% of adult Americans will be eligible for a vaccine, and site locations are doubling. No one says when there will be enough vaccines. What good is eligibility if I still cannot get one?
That's that's a challenging question. So, the rate limiting step now is the amount of vaccine that's coming to the community. We still have people who want to get vaccinated, so that's good. And in the beginning, there was a concerted effort to try to drive vaccine towards those people who are at most risk of dying or having the most serious complications. And so we've got not 100% of those folks are vaccinated as of yet, but an awful lot of them. So it's time to move on. And at the federal level, they're going to be opening it up, or at least making the recommendations to states that it be opened up to all adults. So that's good news. But the questioner is exactly right. The frustrating part is the supply of vaccine does not yet meet the demand. And that's going to continue for a while. I really see the problem is that when we have a vaccine and there's no demand for it. That's the day that I worry about. So
now that I'm vaccinated and still wearing a mask, who am I protecting? You or me?
Technically, you're still protecting both you and me. Now that you're vaccinated, you're protected against the virus, but it's never 100%. And so there's still some protection from those that aren't vaccinated. But also, we don't know how much transmission is decreased if you are exposed to the virus, how much you can transmit it to others. So you're still protecting both you and me.
So the answer is both.
Right.
Your reports on numbers vaccinated do not add up. We totally agree. It says as of April 5th, 30.8% of Houstonians are fully vaccinated and 40.3% have at least one dose. 97% of all of the 60-year-olds have had their first shot. The statewide numbers are much lower. Are these numbers accurate? Have you eliminated people from outside the state who make the trip here? David, you and I were talking about this earlier before we started.
Right. Yeah, so the people from out of state, they have been taken out of the mix, so we're not counting them. One of the challenges we've had is that there are a lot of the the data collection is based on people's zip codes. And so we've had issues with zip codes that are both inside the city and inside the county. And also the state, there's a little bit of a lag between when numbers are collected locally and when they get into the state, but we're really trying to use off the IMTRAC2 database. And so there has been a little bit of disjointedness, I would say, with the numbers, but we're getting that under control. And I think later this week, you're going to see much more accurate numbers. Yeah. The bottom line is, though, here's the bottom line, though. A lot of people are getting vaccinated. And while our numbers on the webpage may not be exact, they are very high numbers, and they're very high, and they're growing every day. We got a long ways to go, but it's all good news.
J&J efficacy is lower than the Pfizer and Moderna. Does efficacy test against severe, mild, or asymptomatic cases? I've heard of more side effects after J&J. Valid reason, or just because it's more potent with one dose?
I can take the first part of that question first, and it's something that Dr. Persse and I have both mentioned in some prior weeks, is that it's really hard to compare the efficacy between all three vaccines, because the way that mild, severe, moderate COVID-19 is defined in each of the studies is actually really different. And so I love that the viewers are asking this question, because those definitions are actually different. And so what we recommend is not necessarily comparing the efficacy rates between the different vaccines, but just know that all the vaccines are safe, all the vaccines are effective, and especially for deaths and hospitalizations and for really severe disease, all vaccines are extremely effective, including J&J. And Dr. Persse, I don't know if you want to take the side effects after J&J.
Yeah. So in terms of side effects, I like to talk about this and put into two different groups: the side effects that people get immediately after the shot, and then the ones that they get, a day or within the following day. And so most of the side effects and most of the events that you see immediately after the shot, which are extremely small, they would really probably have absolutely nothing to do with the vaccine itself. There's a lot of emotion around this. There's a lot of people being, frightened of the virus. They're so relieved when they get their vaccine. And so we're seeing some people, like within seconds or minutes, that are getting a little lightheaded and stuff. And that is almost impossible to be related to the vaccine. So let me just put that aside. The other thing, in terms of the body aches, the shoulder pain, the rash near the injection site, we are hearing that there's a little bit more of that. These are all minor. We are hearing there's a little bit more of that with the J&J. But one thing you have to keep in mind is that these are, on a molecular level, if you will, these are very different vaccines. And so the ingredient list, if you will, in the mRNA, the Pfizer Moderna vaccines is much less. It's an mRNA vaccine. There's much less in it. In the J&J, which is a more traditional vaccine manufacturing process, there's more stuff in there, and therefore there are more things for your immune system to react to. And so it's not a terribly big surprise for those of us who work in this world to expect that there may be some more body aches, a little bit more fever, a little bit more, feeling tired with the J&J vaccine. But again, this is your immune system reacting and getting ramped up. So it's nothing really to worry about, but there is a little bit different with the J&J. So for those folks who are saying, well, I'm having more side effects with the J&J, yeah, but again, a lot of people seem to be wanting the J&J because it's only one shot.
AstraZeneca. German regulators decided to restrict the use of AstraZeneca in people under 30. Sinus vein thrombosis seemed to be prevalent in under 30-year-olds. Why would that be? Emergent Biosolutions Baltimore plant ruined millions of AstraZeneca vaccines. My company would be shut down for a quality control mistake like this. That vaccine doesn't seem to work against variants. Does this take it off our radar in the U.S.? Sinus vein thrombosis on 30-year-olds.
Yeah, so obviously this has been in the news a lot, and it's something that scientists are still trying to look at. There's some theories as to why this potentially could be happening with the AstraZeneca vaccine. One thing to keep in mind is it's really typical for vaccinations to stop, especially new vaccinations, when there are certain side effects or when there are certain reactions, so that these investigations can take place. the numbers are still exceedingly low. I think what I saw yesterday was somewhere around 8, somewhere between 8 to 10 cases of sinus vein thrombosis out of the millions that have already been administered. But it's definitely something that gives the regulators pause and a reason to look into them. But I don't know the exact physiology about why that's happening yet.
Okay, the second question is regarding vaccine that was ruined. This question is saying AstraZeneca. I thought it was J&J that was.
Yeah. So J&J had they said it was a human error, and as it turns out, what it was that the dose within the syringes was, or within the vials rather, was off, and so they had to waste 15 million doses. And so, the questioner is right, is that is a huge quality control mistake. And so a couple of things to be reassured is that it was caught. Now, unfortunately, it was caught after they made 15 million doses of it, but it was still caught before it went to market. And so that has all been destroyed or is being destroyed. And that's a huge mistake. And so the FDA is all over it. That puts J&J, sets them back quite a bit. But we have to be vigilant. The pharmacy industry has got to be vigilant in making sure that mistakes like this don't occur. And so here's an example where the system actually worked. It was a human mistake, and when humans are in the equation, mistakes are going to be made, and so they were able to catch it. So it's bad news, good news all at the same time.
Sinovac. After receiving Sinovac vaccines in Chile, Pakistan, Turkey, and China, cases and deaths rose, and China says postpone pregnancy for 6 weeks. Are any of the other vaccines a concern for those planning a pregnancy?
3 vaccines that we have in the U.S. right now: the Moderna vaccine, the Pfizer vaccine, the J&J vaccine. As far as we know, there aren't any concerns for fertility. There shouldn't be any changes that you have to make if you're planning a pregnancy. Once you're already pregnant, then what we recommend is definitely talking to your physician, assessing what sorts of risks you have to get exposed to COVID-19. And then weighing at what point during your pregnancy you should receive the vaccine, and that should be a personal decision between the woman and the physician. But at least in terms of fertility, there aren't any issues that we know of with fertility for any of the 3 vaccines that we have in the U.S. right now.
Men and women receive different doses based on weight?
No, it's the exact same dose.
AARP had an interesting report. What do you think? Women have a stronger immune response to vaccine than men. More women than men are experiencing side effects from vaccine. Men are less likely than women to report side effects. Will the docs agree on this one? Probably the last one, baby. Go ahead.
Yeah, so I haven't seen that AARP report, so I don't know what they're basing it on, but so I really can't comment on any of those, quite honestly, but I will agree with whatever Dr. Rivera says.
I'm
sure she didn't read the AARP magazine.
I did not read the AARP article either, but we can look into it for sure.
Men are less likely than women to report side effects. That's behavioral, and I guess. Are higher levels of testosterone linked to a weaker immune response?
I have not heard that at all. In fact, yeah, there really shouldn't be any correlation there.
That seems like another male-female question. Yeah. Vaccine identification. As there seems to be an ID controversial for many people, what ID is needed in Texas to get vaccinated? That question came up before.
Yeah,
so when I was given shots, I wasn't, maybe that happened before they got to me, but I wasn't checking IDs.
You basically checked in with a QR code or some identification code, right?
Yeah, I agree. And I think where this issue comes up is that there are a couple sites that will ask you for ID and insurance, just because there's a component that could be billable to insurance. So some of the doctor's offices, etc. But if you go to any of the public health sites or any of the federal sites, then you will not be asked for it.
To receive a second shot, is the vaccine card all that is required as identification?
And a lot of places are sending you notification, whether it be a QR code or an email. I mean, some places are doing it a little bit differently from others, but not only do you have the card that you got the first time, but in many, depending on where you got your first shot, you're going to get additional proof that you're supposed to, to schedule you for the second, so you can show up, you can have something that can be through email.
Last week, there was a question about vaccine passports and the CDC leaving them to the private sector. Now, both Texas and Florida have issued bans and said you should not have to show proof to participate in normal society. Can't the private sector demand to see proof? Doesn't this non-governmental issue standard documentation open us up to fake proof?
There's different places around the country and different private universities that are going to require vaccine. I think at least the way that I read the governor's order, and would love to hear what Dr. Persse thinks as well. But if you're a public agency or if you're receiving any form of public funds, then you will not be able to require proof of vaccination. There's certain private universities and private institutions throughout Texas that are planning to require vaccination from their employees. And the issue of fake proof is something that I think is already starting to come up. There's some people that are selling fake vaccination cards, and so I think it's something that we're definitely thinking about. I don't know that we have a solution to that yet, and I don't know that the state has a solution to that yet, but it's definitely something that we're aware of that could happen.
Seems ironic that you would actually pay for one of those fake cards to, in fact, expose yourself or take the potential risk. Right. CDC now says the UK variant accounts for 26% of US cases. Can you provide specific local data? Actually, been talking about that for the last couple of weeks.
From the city standpoint, we've been seeing a lot of UK variant in the wastewater, and we do calculate a percentage of that, but I'm not going to share it because it does not correlate with what percent of the population may have the UK variant because of the way, you gotta remember the wastewater, it's all mixed, right? And so you really can't extrapolate that, but the level has been fairly high. And what we've seen is the number hasn't been rising, but we're finding it in more neighborhoods. So it's spreading geographically as opposed to in terms of the amount of vaccine or virus rather UK virus that we're seeing in the wastewater. But our friends with Houston Methodist are sequencing everybody who gets admitted, and they've come out and they've said that it's been about 70% of the patients who are admitted within the Methodist system across the 9-county region are infected with the UK variant. Now that's also, while that's a large number, they've also said it's been relatively steady over the past several weeks. So there's a lot of UK variant here. And our numbers, our overall hospitalizations, in spite of that, our overall hospitalizations continue to trickle down at an ever so slow rate. So while there's a lot of UK variant, we are not seeing the surge that we would have expected based on what we're seeing up in New England states and Michigan and Florida.
Okay, there have been several questions regarding variants and confusion surrounding the topic. Is it true that more virus spreads, more mutations are possible, and the more people are vaccinated, the less mutations?
That's the general gist. Viruses over time will always mutate and essentially try to get smarter so that they can infect more people and infect as many people as possible, essentially, and continue to do that. And so as we vaccinate the population, the goal is if we can vaccinate really quickly, just the number of viruses in the community will decrease, and that'll prevent some mutations. I think that's what that question was getting at.
Please catch us up on variants. UK B117 is in every state and seems to be hitting young people hard. Is that true? South African, Brazilian, New York seems to be more contagious. Is it called a variant of concern rather than of interest?
The wastewater, we've detected the South African, the Brazilian, the New York, both California variants, but in really, really low numbers, really, really low amounts. There have been, I'm trying to remember, there have been only like a handful of cases, Dr. Rivera, you may know better, of other than UK, South African, Brazilian, or other variants in patients who've been hospitalized. Really, really small numbers. So are they here? Yep. But right now, UK variant seems to be the one that's sort of pushing everybody else out of the market, if you will.
India variant was found in California called a double mutant variant of concern.
Yeah, that's true. It's the label double mutant is really a misnomer because many of these variants have got multiple mutations with them. So how that one got called a double mutant, which makes it sound like it's doubly bad. Turns out that's not an accurate characterization. It's a new one. We're still learning about it. Don't know really what to think of it yet because we just don't have the data, but I would just consider it to be yet another variant.
The Army is starting tests with a protein-based vaccine. Researchers say it may protect against a variety of coronavirus variants. Is this one off or one of many trials of this type? Why haven't we dealt with the common cold?
There's definitely other vaccines that are still being tested, trialed, developed, especially in the light of new variants, different types of boosters. And so the U.S. Army vaccine is one of many that are still being trialed, and I'm sure we're gonna see others that are coming in through the pipeline as well.
According to a former FDA commissioner, the U.S. will not have a true fourth wave. We're near a vaccine inflection point, but not quite there yet. We need another 2 to 3 weeks.
I'll jump with that. I would agree with that partly. I'm not going to say whether or not we're going to have another fourth wave, because if this virus has taught us anything, it does not follow any of the rules that apply to seemingly every other virus, and it is highly unpredictable. So I'm not going to say that we're not going to see a fourth wave, but I am really optimistic for the first time in a long time. We're getting a lot of vaccine out. We are now 4 weeks after the governor lifted the mask mandate and opened up businesses to 100%. Now, he may have done that on whatever day, but the public didn't immediately respond to go to full speed on that. So over the ensuing weeks, there have been more and more people who have been, gathering in restaurants, more and more people have been going without their masks. It didn't all occur on that day, but we're 4 weeks out now. So I would start thinking that beginning now is when we might start seeing the impact of that. But at the same time, as we mentioned earlier, we've got a lot of vaccine in the community now. We got, somewhere in the neighborhood of 20% of people are vaccinated. So if we got 20% of people are vaccinated, and then of course it's a total estimate, we've got another 20% of people who may have some immunity from prior infections. That's 40% of the population may have some degree of immunity. So that's going to slow down the virus. And remember, when we talk about herd immunity, it's not a light switch, it's not on off, it's a dimmer switch, right? And so it may be right now that it's slowing things down, that we're not seeing the big wave that we would have expected from the lifting of the restrictions, because the last couple of times we lift the restrictions, we did see big waves. So it may be that, that it's between the vaccine and the lifting of the restrictions, it's a bit of a stalemate. Because again, overnight last night, Texas Medical Center and CETRAC both reported yet another 100 plus admissions to hospitals for people who are infected with COVID. So it's not gone. We're just at a stalemate right now.
Researchers say coronavirus is inactivated by sunlight. Shortwave UVC radiation has shown to deactivate viruses, and sunlight can achieve the same effect. Coronavirus's particles are rendered inactive within 30 minutes of exposure to midday summer sunlight. So is a beach vacation in our future? What is the takeaway from this information? Any vacation I would love.
Well, beach vacation sounds nice just to relieve some of the stress of this year, spend some time outside. But I think in general, that's not what we're recommending as the primary method to try to decrease spread and decrease the virus. As far as I know, it has to be really direct UV radiation. The virus has to be completely unexposed. So if there's sand or anything on top of the virus, that definitely affects it. The CDC is not recommending using UV light as one of the sole methods of cleaning or disinfecting. And so I think that it's one thing that it teaches us is that potentially when there is coronavirus, SARS-CoV-2 is on some of the surfaces, then perhaps the sunlight can help with that. And I think, and the CDC has come out with a lot of information this week on coronavirus on the surfaces, but I wouldn't rely on that and say, if you're on the beach, you're safe, there's gonna be no COVID, just because it's sunny.
Neuropsychologist Catherine Loveday told the BBC that people who are confined to their homes report memory lapses, feel more forgetful, and less able to concentrate. This appears to improve when they get out again around others. Is this improvement accurate, or will our brains continue to zoom away? Now I know you have the exact answer for this. Come on.
Well, Dr. Loveday is a neuropsychologist, so I am not going to challenge her opinion, but but I think that there is I don't disagree with what she's saying. We are social beings. We need to be in social environments. Zoom and FaceTime and Skype and all of these things have been slowly coming into our community long before COVID. And so we find that, for example, we can do a lot of good counseling for folks over Zoom and Teams and things like that. And these are good ways to communicate with people. But it's probably still not exactly the same as being able to hug your loved one and laugh out loud around a dinner table. And so that's all part of the human experience. And so this is just another reason why it's important that people get vaccinated so that we can get back into that environment, because it's good for our brain, it's good for our heart, it's good for our soul. We need to get back there.
British Medical Journal reports that few are testing and self-isolating from symptoms, and only half the population know the symptoms. Not that we aren't hearing information constantly, but are you seeing the same lack of awareness here? Well, the testing numbers have gone down significantly.
Yeah, and I don't know if it's necessarily a lack of awareness or what's going on, but like you said, Stephen, the numbers, our capacity for testing far exceeds the number of people that we're seeing getting tested right now. The number of people getting tested has significantly decreased. So we keep trying to remind people, if you have any symptom, and COVID-19 has so many different varied symptoms that can seem like the common cold at times, can seem like the flu, can seem like others. Just don't guess, take the test was our motto then. It continues to be our motto.
Doctors in the media give their personal opinions and totally disagree with each other. Docs are supposed to do no harm. Isn't there some ethics at work that says this also means do not confuse the public with opinions and ignore science? Y'all actually pretty much agree on everything. So they're talking about those other docs, right?
Yeah.
Yes.
Yes.
Dr.
It's
Persse,
always those other docs.
Yeah, those other.
not your Harris County docs. Your Houston docs are on.
I think it's fair to say that when one is given an opinion, that you should say it's an opinion and, not based on science or some level of objectivity. A mailing to specific zip codes in Houston, allegedly from Louis Farrakhan and the Nation of Islam, warned Black residents not to take the vaccine. A survey says 49% of Republican men will not take the vaccine. Many in our community are listening to the messengers and not researching the actual message. What can we do? I can tell you what we're doing, and I think this needs to happen, and that is go to trusted messengers within the communities, people that folks interact with on a regular basis, and try to provide them with accurate, scientifically based information so they will actually know. And actually, let people, communicate their fears or, sensitivities to you so that we can actually address them in a very open and honest way. I don't know that we should go out, just, preaching, get the vaccine, which we know we want people to get the vaccine without really taking note of what their interests and concerns are. And I really will follow up on this issue regarding this Nation of Islam deal, because that is concerning to me. Because when we look at certain zip codes, primarily that are populated by African Americans and Latinos, the vaccination rates are not where we want them to be, and so that is concerning. Oh, y'all not going to say anything? Eh? Okay.
We agree.
Yeah, no, we agree. I was thinking as you were talking, Stephen, just an observation. I've been thinking this, with all these things that come out that, are scaring people. And it's one of my frustrations, and I don't know how to get around it, is that, as human beings, we seem to love to have a juicy story or a conspiracy. And so when people plant those seeds in our minds, it's like somehow many of us are sort of naturally drawn to want to believe the ugly story and want to believe the conspiracy theory, especially when not especially, but even when there's nothing to support it at all. And so that bothers me as somebody who wants to educate people completely and transparently so they can make their own decision, when I'm fighting against an inherent desire to want to believe the lies. Like, I don't know how to compete our our apparent desire to want to believe the crazy, ridiculous thing when all I can do is give you the facts and the truth. I don't really have anything to compete with, and so it's frustrating. So I think we continue to give people factual information in a transparent manner, respect their ability to make a decision for themselves, and then hope that they won't believe the malarkey that's being fed to them by others.
Absolutely.
Yeah, I completely agree. And I think the one thing that I know that both the city and the county are doing too, because at least both these that were mentioned, there's been a lot of talk in the media about faith leaders not recommending the vaccine. I know that a lot of evangelical Christians have been recommended not to receive the vaccine. It seems like also from the Nation of Islam. And so for us also partnering as the health departments with our faith leaders to see what are some of those conversations that are going on in your congregations? Can we talk about them openly with you? Do you want to make us, we're happy to serve as resources if people in your congregation have questions, but really just working with our communities, and just totally echo what Steve and Dr. Persse said as well.
Vaccinated people do not carry the virus.
Not entirely true. The vaccines are not 100% protective. We know that the Pfizer and Moderna are about 94, 95% protective in preventing you from becoming symptomatically ill with it. Pfizer recently came out and said that theirs is 90% effective in preventing you from becoming infected, but that still means that there is a small chance that you could become infected, carry the virus, and probably an increased risk that you'd be asymptomatic because you're vaccinated and be able to spread it. Again, going to the earlier question about the mask. So even if I'm vaccinated, if I'm going to be around somebody who I want to make sure that they don't get it, like if I'm going to go visit my grandmother in the nursing home, even though I've been vaccinated, I'm probably going to wear the mask on the off chance that I might be infected and be able to spread it to my grandmother, and I don't want to do that.
Absolutely, and that's related to the next to the last question. That's fully vaccinated people can travel without testing or self-quarantining.
Yeah, and so the CDC came out with some guidelines around this last week, and if for domestic travel, if you're fully vaccinated, then yes, the recommendation is that you don't necessarily have to quarantine after, you don't necessarily have to test. For international travel, that's a little bit different. You're still recommended to test. And I think one thing that's really important to keep in mind is that even though those are the recommendations from the CDC, there's lots of states and lots of countries that have their own guidelines. And so there's certain restrictions to enter some states. There are certain restrictions to enter some countries, and so definitely, if you're going to be traveling, look to see what those restrictions are, because right now it's not a blanket policy. If you're vaccinated, you can just go anywhere and do anything and not quarantine and not get vaccinated. There's still restrictions throughout the world.
Okay. In terms of how long the vaccine lasts, the protection of those who were vaccinated and those who were vaccinated and previously had COVID appears to be the same.
We're still learning. It appears that if you were ill before, your level of protection, your natural immunity from that infection seems to be correlated roughly, not directly, but roughly correlated with how sick you got. And so those folks who were more severely ill and were in the hospital seem to have a more robust level of natural immunity once they get discharged from the hospital than those who were sick and at home, or those who weren't symptomatic at all. Now, it's not a linear relationship, but there does seem to lean that way. What we do know with those who are vaccinated is that, and so Pfizer this last week or so just came out and said that they now can demonstrate that there's high level of protection 6 months after vaccine. And somebody said to me, well, only 6 months. Well, no, it's only been 6 months. So 3 months from now, they're going to probably come out and say they now know that it's protective for 9 months. And then 3 months after that, they'll probably come out and say they know that it's good for 12 months, because it has to be in the population long enough for them to test people to see how long you continue to produce antibodies to a level that they believe to be protective. So I would not say that the protection from vaccinated and having been ill is the same. I think vaccinated is probably better, because when you get ill with it, it appears to be so incredibly variable how long your protection.
Thank you. Well, this ends our COVID-19 talk with local health authorities. Dr. Maria Rivera, representing Harris County, Dr. David Persse, representing City of Houston. I want to thank you to Ash Morgan, who's helping us with the technology here. And thank you to Kathy Fininger, past president of Rotary Club of Houston. I'm Stephen Williams, the Director of the Houston Health Department.